Welcome to the Health Zone. I am Dr. Toju Chikiobi, but everybody calls me Dr. Toju. Today we're going to be talking about antenatal care and why it matters. With us in the studio today is Dr. Chito, a consultant obstetrician gynecologist. We're very excited to have her because we will learn a lot about antenatal care from her. So why don't you come on and join us on the show? On today's episode of the Health Zone, we will be talking about antenatal care and why it matters. With us in the studio today is my good friend, Dr. Chito. Dr. Chito is an American-trained and board-certified obstetrician gynecologist, and she's also the medical director of Tabitha Medical Center in Abuja. Dr. Chito has many years' experience as an obstetrician gynecologist, and she's very active as a speaker on the international scene and also teaching on healthy lifestyles. She is also passionate about community service, and we're really honored to have her with us here in the studio. Welcome to the Health Zone, Dr. Chito.
Thank you.
It's great to have you with us again, and I'm really thrilled. Welcome to the show.
Thank you. Thank you for having me.
Well, as we always do on the show, we go out to the man on the street and find out what the man or woman on the street knows about antenatal care. So we're going to do that. Is that okay?
Yeah, that's fine.
Okay. So we will take a break now and go out to the man on the street and find out what they know about antenatal care and why it matters. And we'll be right back.
Another segment of Health Zone Man on the Street. My name is Hanifat, and today we're talking about antenatal care.
I don't know.
Antenatal care, as in...
Well, care in terms of isn't how you take care of your body, your system, everything.
As in, you going to check up, go to hospital, check yourself, know if you're okay, all right, something like that.
It's all about pregnant women, their routine checkups. It enables them to check if their babies are really okay in the womb.
Okay, it's just for a pregnancy woman.
It's we, of course. We, human beings. Yeah.
You have to be pregnant of maybe starting from 3 months. Then you can go for antenatal.
I don't think without antenatal, most of the ladies would have made it throughout that pregnancy process. So, with the help of antenatal, it enables doctors to take care of them very well.
It's very important for women so that they will know how the woman is feeling, how the baby inside the woman is, maybe everything is okay within the system of the woman.
Welcome back to the Health Zone. On today's episode, we're talking about antenatal care and why it matters with Dr. Chito. So Dr. Chito, that was very interesting, what we heard from the man and woman on the street. It was, to me, it was interesting to know that quite a few people did not know what antenatal care is, including women.
Yes.
Right? Mm-hmm. And in fact, one person thought it was care for everybody, which was really interesting. So I hope on today's show you'll really help us clarify, what is antenatal care?
Antenatal care is the health care that is given to a woman that is pregnant to ensure that the mother and the baby is healthy throughout the pregnancy. So antenatal care is something that's very important for the pregnant woman, and I want to emphasize pregnant, so it's not for everybody. And it's something that is really, in Nigeria, picking up really fast. Many governments have allowed free antenatal care to encourage women to come in as early as possible to receive that care from the doctor or the midwife to ensure that the baby is born healthy and the mother is remains healthy throughout the course of the pregnancy.
Okay, so who needs antenatal care? Is it some pregnant women or all pregnant women?
All pregnant women need antenatal care. Okay. You know, it would be nice to share that most women that do not get antenatal care, their babies are 3 times more likely to come out really small, and that makes for an unhealthy baby. Or the mothers are 5 times more likely to die. So when you think of that number, you know the antenatal care is not just something that's optional, it's actually something that is more mandatory for women to get. So that's why it's such a big deal, especially in Africa.
Okay, so Dr. Chito, you said every pregnant woman should have antenatal care. However, there's some people say, what is the big deal? Pregnancy is a natural phenomenon, and women have born children for centuries. So why should we get antenatal care? What's the big deal about getting antenatal care?
I want to talk specifically for Nigeria right now, since we're here, but it is really a big deal. About 30% of the global maternal rates is in Nigeria. And that means about 36,000 women die each year from childbirth, all right, through pregnancy. And you want to really understand that number, imagine 200 medium-sized, airplanes crashing every year. That's the number of people that die from childbirth. Wow. So it is a great deal that women do seek health care when they're pregnant. And most women, that's the first time we actually see women is when they're pregnant. So in many ways, I think it's really necessary that once you find out you're pregnant, as early as possible, you go to the doctor to care for you, or midwife.
Okay, and I think I also understand that in sub-Saharan Africa, child marriages are quite common. So we have young girls getting pregnant. Isn't that a problem as well?
It is a problem. Even in the U.S., you have a lot of teen pregnancies. And the thing about young teenagers becoming pregnant, they are at risk for some things that an average age person may not be at risk of, especially social factors. So for them, it's actually very imperative that they come in early and you guide them through the pregnancy and make sure that their baby comes out healthy and they too survive the course of pregnancy. I don't want to make pregnancy sound very scary because it's not. It's a joyful period. But it's important that they come and we care for them each stage of their pregnancy so that they are able to birth easily and come out happy and celebrate the birth of their baby.
Okay. So, Dr. Chito, what is the main goal? What is the overarching goal of antenatal care? What is it that you're trying to accomplish with antenatal care?
I'm very happy you asked this question because most times that women don't come to us is because they don't know why. Why do I need to have health care during pregnancy? What's different about me? Well, the truth of the matter, it is very important. A mother is not the same, woman is not the same when they're pregnant as if they're not. Because when you're pregnant, so many changes happen to your body. And we know that as healthcare practitioners. And so when you come to us, we take detailed history, medical history, your social history, meaning things that you do in case you drink alcohol or you smoke or things like that. We take your family history, which is very important in your pregnancy, what happens in your pregnancy. We want to find out about your previous pregnancy. So we really go into details and trying to learn about you.
And there are other interventions, other things that you're trying to do as well, because sometimes for many women in sub-Saharan Africa, that antenatal care is the only time they see a doctor.
Yes.
So you want to you actually use that opportunity for other things, don't you?
Definitely. I think that I'm well known for anytime I catch a woman in the first trimester, I get a pap smear. And I think because most women never come to the doctor unless they're sick. That's really a Nigerian thing, right? People don't seek the doctor unless they're sick. And so when they're pregnant and they come in, you're able to identify things they may have been living with all this while. And so you can actually manage those things starting from there and then continue manage them through their pregnancy.
So at what stage in pregnancy, because I know pregnancy has different stages, yes. So I want you to talk to us about the stages in pregnancy, but before you do that, we're going to take a short break and we'll come right back. Is that okay?
Perfect.
Okay, so we'll take a break now and we'll be right back to talk to Dr. Chito some more. Welcome back to the show. Today we're talking with Dr. Chito Nwana about antenatal care and exactly why it matters. So Dr. Chito, please explain to us I know that in pregnancy there are different stages of pregnancy. So tell us about the different stages of pregnancy, and then you'll talk to us about how it ties into the care that we give a pregnant woman.
There are actually 3 stages of pregnancy. The first stage is from 4 weeks of pregnancy, obviously because you don't know if you're pregnant till you get to that point. So from 4 weeks to 12 weeks. Some people will say 4 weeks actually to 13 weeks. So it depends on which way you go. Then the second stage will be from 14 weeks, if you're using the 13-week mark, 14 weeks to 28 weeks of pregnancy. And in the lame term, that would be till 7 months, because most people like to use months instead of weeks. And the third stage of pregnancy is from the 28 weeks till you give birth. All right, so that's the third stage of pregnancy. Now, in each stage, we do different things. So in the first stage of pregnancy, you get your first visit. Your first visit is usually your longest visit because it's when we sit down and we take your detailed history, get to know you better, get to understand any medical condition you may have, even as simple as have you had asthma before. After that first visit, the other visits are really very quick visits unless there's a problem. All right, so when your other visits you come, we do just, we do weights because we want to know how much weight you're gaining. That's also very important. We don't like mothers gaining too much weight. A lot of women use that as an excuse to get fat.
To eat a lot. They say they're eating for 2, right?
Yes, and that's a big myth. You're not meant to eat for 2. It's not an excuse. And we all have our cravings, and in pregnancy you get a lot of cravings. But we try to manage this and keep their weight down to what they're meant to gain, which is about 25 to 35 pounds most times in pregnancy. But in the second stage, at the end of your second stage, we do something that I'm going to really kind of emphasize. And that's checking the glucose in the mother's blood, the sugar level. And why that's important is something that's not done commonly, but must be done. Because diabetes, as we know, is already endemic in our country. And so not screening mothers for this at that point could lead to a mother having diabetes in pregnancy. You don't know, the baby gets really large, and it can lead to stillbirth also.
So how many times should a pregnant woman be seen during the course of her pregnancy?
Okay, I'll leave the World Health Guideline for after, because I'm not a fan of it as such. But I think the first stage of pregnancy, so between 4 weeks and 13 weeks, if you want to use 13 weeks, is every month.
Yes.
Okay, so between 4 weeks and 14 weeks, we see our patients every month. Actually, let me correct myself. Between 4 weeks and 27 weeks, we actually see our patients once a month. Okay. All right, unless we identify a problem, then we will see the patient more frequently. From 28 weeks, we see the patient every 2 weeks up to 36 weeks. And in layman's terms, I think 36 would be like a 8-9 months kind of thing.
Yes, 8 months.
8-9 months. So
yes. The beginning of your last month.
Beginning of your last month. So we see you every 2 weeks. And from 36 weeks, we see you every week till give birth to your baby. Now, World Health has given their guidelines. And I think their guidelines are more focused on women living in rural areas that have very limited access to healthcare. So to encourage mothers in those areas to actually seek healthcare, they said, you know what, you must at least have 4 visits. 1 in the first stage, I guess 1 in the second stage, and about 2 in the third stage.
I see. All right, thank you very much. That's great. So I'm going to ask you my next question, which is, what are the danger signs, the warning signs for complications in pregnancy? But before you answer that, we'll take a short break and we'll be right back. So we'll be right back after this short break. Welcome back to the Health Zone. Today we're talking with Dr. Chito Nwana about antenatal care and why it matters. So Dr. Chito, what are the warning signs, the danger signs in a pregnant woman that tells us she's headed for complications?
Well, I don't want to scare pregnant women per se, but I want to mention some few things with them knowing that these are things that could be managed if you seek care. And one of the most common ones we find in the first trimester is excessive vomiting. All right. Some women have a lot of vomiting, a lot of, not just nausea, they can't keep even water down. And those patients have to be managed carefully, make sure they're well hydrated. And the things that you have to make sure that what's the link term for electrolytes are balanced in their body. The chemistry, yeah. The chemistry of the body is balanced. And you have to take care of the baby in that way. But excessive vomiting is one. And later stage of pregnancy, we look at excessive vomiting as being connected to high blood pressure in pregnancy.
Okay, wow.
All right, so that's one. Two, if you have bleeding during pregnancy, we normally don't like seeing bleeding during pregnancy. In the first stage, the fear is that you may be having a miscarriage. And I think that's why most people don't tell people they're pregnant until they get to 12 weeks or you want to say 4 months. Because they believe that, let's not announce that I'm pregnant just in case I have a miscarriage. Okay. Because that is really the risky time for having a miscarriage. After 10 weeks, you're less likely to ever to miscarry the baby. But if we see bleeding in other stages, we're concerned.
So what are the main complications for pregnancy?
Well, I think I have to break them in stages. So in your first stage of pregnancy, I worry about things like miscarriage. And some women are more predisposed to it, especially where it concerns either maternal age or like if you're advanced in maternal age, you have that risk of a higher rate of a miscarriage. The later stages, I worry more about preterm labor, all right? We try to teach them, educate them what not to do, or teach them about the signs. Like if you have lower abdominal cramps consistently, or if you have a lower back pain consistently, come to see us. Because that might be a sign of early labor. Mm-hmm. And so that's one of the concerns we worry about. We worry about high blood pressure issues in the mother. All right, because as you know, that's a very high cause of maternal mortality.
Yes. So let's talk about something else that has a big impact on the pregnant woman and what she's carrying, and that is the effect of cultural beliefs and myths. I want us to address some of those cultural beliefs. For example, I came across a cultural belief that in some societies that they don't talk about pregnancy. A woman should not acknowledge that she's pregnant.
See, that will have a really negative impact on the mother. You know why? Because she can't tell anybody she's pregnant. She's not going to tell anybody she's not feeling well. She won't tell anybody if something is happening with her or the baby. And so she'd be, just left really much alone in that way. And she won't go to the doctor or to see the midwife or anything like that. But most importantly, she'd be, her lifestyle won't change. If she's going to the farm and bending down and farming all day, she'll be farming all day. And we all know that sometimes at a certain stage of pregnancy, you can't be doing everything.
Yeah. Good. All right, another myth we came across, this is actually in Ghana. In some areas, they tell mothers not to eat bananas because it causes premature contraction. Now, what I know about bananas is bananas are a high source of potassium. Does that in any way impact pregnancy?
No. I don't think so. I think because you want the chemistry in your body to be balanced,
exactly.
Right? And I think eating bananas is pretty much safe. The only time I limit bananas as such is if you're diabetic, and I'm trying to count calories, and we say, okay, just eat one banana, in your terms of fruits. Yes. But other than that, I think banana is a good source, a good fruit to eat if the mother. See, in pregnancy, it depends on what you can eat.
Tolerate.
Yeah, it depends on what you can eat. Yeah. Makes you will make you sick. I think bananas are fine, honestly.
Okay.
But should I say something?
Yes.
What you can take that could make what can make you contract early is things like that has what we call potash. So I will not allow my pregnant woman to go out to a bar and eat ishewu.
Oh, okay.
Do you understand? Because yes. Things like that, I will tell the mother, don't eat your regular ishewu or nkobi or stuff like that outside unless you make it yourself and you make sure you don't put potash in that. So there's certain things like that I'll tell the mom to
avoid.
Yeah.
Okay, so we have all these, I don't need to even go through all of them, but one that I do want to highlight is the colostrum, that you shouldn't give the newborn baby. Pregnant women should discard their colostrum when they have the baby. So
that's the best part of the breast milk.
Colostrum is the first part of the breast
and the
milk
best
when you
part.
first have the baby.
And it's the best part. It has, a high concentration of nutrients than the other part of the breast milk. So you want your baby to get that colostrum. I mean, that's one thing you're hoping your baby can just get. You don't want to, by mistake, pump it out or anything. You want your baby to get that colostrum.
Absolutely. Well, Dr. Chito, this has been terrific
as
always. Thank you. You have enlightened and
I hope I've covered as much as
Yes, you have. You've taught us a whole
Thank you.
a lot about what antenatal care is and why it's important. And I thank you very much for coming on the show. And I hope you'll come back again to discuss other obstetrical and gynecological issues with us. But it's been a pleasure having you on the show. Thank you.
Thank you.
So we'll take a break now, and when I come back, I will talk to you guys about the take-home message of everything Dr. Chito talked about. What are the things that we must remember, the most critical things she addressed that we can use in our lives and teach other people as well about. So we'll be right back after this short break. Don't go away. Welcome back to the Health Zone. We've been talking with Dr. Chito Nwana about antenatal care and why it matters. Here are the things to take home. Antenatal care is the care of a pregnant woman to ensure the safety of the woman and the child that she's carrying. And every pregnant woman should receive antenatal care. She talked about how important it is that we receive a minimum of 4 visits during pregnancy. In industrialized societies, the goal is 12 to 14 visits. The goal of antenatal care is really to prepare the pregnant woman for birth and for being a parent. And so during antenatal care, there's some things that are focused on. 3 main areas she addressed. The first area is she addresses any existing condition the woman already has before she got pregnant, because that might worsen during pregnancy. The second area is to address the actual complications of pregnancy itself, to ensure that during the pregnancy, the woman doesn't develop any complications. And the third other broad area that antenatal care covers is to just take care of address any unhealthy lifestyle. Whatever she's doing that is an unhealthy lifestyle that will adversely affect the pregnancy. And so she addressed the issue of food taboos, that there's certain food taboos that really have no basis in fact. And so she talked about how good sources of protein are critical in pregnancy, so meat and eggs and snails are okay. Lastly, she addressed the issue of alcohol. Alcohol is the only complete taboo in pregnancy. A pregnant woman should not be taking alcohol at all because of the possibility of developing fetal alcohol syndrome in the child, which is a really devastating disease where there's mental retardation. It's been terrific having you join us on the show. And from me, Dr. Toju, stay healthy.